LAIV intranasal influenza vaccine, current year. What you need to know. Vaccine information statements are available in Spanish and many other languages. See www.immunize.org/VIS. 1. Why get vaccinated? Influenza, or flu, is a contagious disease. It is caused by the influenza virus, which can be spread by coughing, sneezing, or nasal secretions. Anyone can get influenza, but rates of infection are highest among children. For most people, symptoms last only a few days. They include fever, sore throat, chills, fatigue, cough, headache, muscle aches. Other illnesses can have the same symptoms and are often mistaken for influenza. Infants, the elderly, pregnant women, and people with certain health conditions, such as heart, lung, or kidney disease, or a weakened immune system, can get much sicker. Influenza can cause high fever and pneumonia, and make existing medical conditions worse. It can cause diarrhea and seizures in children. Each year, thousands of people die from seasonal influenza, and even more require hospitalization. By getting vaccinated, you can protect yourself from influenza and may also avoid spreading influenza to others. 2. LAIV attenuated influenza vaccine, LAIV, nasal spray. There are two types of influenza vaccine. 1. LAIV attenuated influenza vaccine, or LAIV, contains live but attenuated, weakened influenza virus. It is sprayed into the nostrils. 2. Inactivated, killed influenza vaccine, or the flu shot, is given by injection into the muscle. This vaccine is described in a separate vaccine information statement. Influenza viruses are always changing, so annual vaccination is recommended. Each year, scientists try to match the viruses in the vaccine to those most likely to cause flu that year. It takes up to 2 weeks for protection to develop after the vaccination. Protection lasts about a year. LAIV does not contain thimerosal or other preservatives. 3. Who can receive LAIV? LAIV is recommended for healthy people 2 through 49 years of age who are not pregnant and do not have certain health conditions. See number 4. People who got the 2009 H1N1 pandemic influenza vaccine or had pandemic flu in 2009 should still get the current year seasonal influenza vaccine. 4. Some people should not receive LAIV. LAIV is not recommended for everyone. The following people should get the inactivated vaccine, flu shot, instead. Adults 50 years of age and older, or children from 6 through 23 months of age. Children younger than 6 months should not get either influenza vaccine. Children younger than 5 years with asthma or 1 or more episodes of wheezing within the past year. Pregnant women. People who have long-term health problems with heart disease, kidney or liver disease, lung disease, metabolic disease such as diabetes, asthma, anemia, and other blood disorders. Anyone with certain muscle or nerve disorders such as seizure disorders or cerebral palsy that can lead to breathing or swallowing problems. Anyone with a weakened immune system. Anyone in close contact with someone whose immune system is so weak they require care in a protected environment, such as a bone marrow transplant unit. Close contacts of other people with a weakened immune system, such as those with HIV, may receive LAIV. Healthcare personnel in neonatal intensive care units or oncology clinics may receive LAIV. Children or adolescents on long-term aspirin treatment. Tell your healthcare provider if you have any severe, life-threatening allergies. Allergic reactions to influenza vaccine are rare. Influenza vaccine virus is grown in eggs. People with a severe egg allergy should not get influenza vaccine. A severe allergy to any vaccine component is also a reason not to get the vaccine. If you ever had a severe reaction after a dose of influenza vaccine, tell your healthcare provider. Tell your healthcare provider if you ever had Guillain-Barré syndrome, a severe paralytic illness also called GBS. Your provider will help you decide whether the vaccine is recommended for you. Tell your healthcare provider if you have gotten any other vaccines in the past 4 weeks. Anyone with a nasal condition serious enough to make breathing difficult, such as a very stuffy nose, should get the flu shot instead. People who are moderately or severely ill should usually wait until they recover before getting flu vaccine. If you are ill, talk to your healthcare provider about whether to reschedule the vaccination. People with a mild illness can usually get the vaccine. Five. When should I receive influenza vaccine? Getting the vaccine as soon as it is available will provide protection if the flu season comes early. You can get the vaccine as long as illness is occurring in your community. Influenza can occur anytime, but most influenza occurs from November through May. In recent seasons, most infections have occurred in January and February. Getting vaccinated in December or even later will still be beneficial in most years. Adults and older children need 1 dose of influenza vaccine each year. But some children younger than 9 years of age need 2 doses to be protected. Ask your healthcare provider. Influenza vaccine may be given at the same time as other vaccines. Six. What are the risks from LAIV? A vaccine, like any medicine, could possibly cause serious problems, such as severe allergic reactions. The risk of a vaccine causing serious harm or death is extremely small. Live influenza vaccine viruses very rarely spread from person to person. Even if they do, they are not likely to cause illness. LAIV is made from weakened virus and does not cause influenza. The vaccine can cause mild symptoms in people who get it. Mild problems. Some children and adolescents 2 to 17 years of age have reported runny nose, nasal congestion or cough, headache and muscle aches, fever, wheezing, abdominal pain or occasional vomiting or diarrhea. Some adults 18 to 49 years of age have reported runny nose or nasal congestion, cough, chills, tiredness, weakness, sore throat, headache. Severe problems. Life-threatening allergic reactions from vaccines are very rare. If they do occur, it is usually within a few minutes to a few hours after the vaccination. If rare reactions occur with any product, they may not be identified until thousands or millions of people have used it. Millions of doses of LAIV have been distributed since it was licensed, and the vaccine has not been associated with any serious problems. The safety of vaccines is always being monitored. For more information, visit www.cdc.gov at the address on the screen. 7. What if there is a severe reaction? What should I look for? Any unusual condition, such as a high fever or behavior changes. Signs of a severe allergic reaction can include difficulty breathing, hoarseness or wheezing, hives, paleness, weakness, a fast heartbeat, or dizziness. What should I do? Call a doctor or get the person to a doctor right away. Tell the doctor what happened, the date and time it happened, and when the vaccination was given. Ask your healthcare provider to report the reaction by filing a Vaccine Adverse Event Reporting System form, VAERS. Or you can file this report through the VAERS website at www.vaers.hhs.gov or by calling 1-800-822-7967. VAERS does not provide medical advice. 8. The National Vaccine Injury Compensation Program. The National Vaccine Injury Compensation Program, VICP, was created in 1986. Persons who believe they may have been injured by a vaccine can learn about the program and about filing a claim by calling 1-800-338-2382 or visiting the VICP website at www.hrsa.gov/vaccine compensation. 9. How can I learn more? Ask your healthcare provider. They can give you the vaccine package insert or suggest other sources of information. Call your local or state health department. Contact the Centers for Disease Control and Prevention, CDC. Call 1-800-232-4636. That's 1-800-CDC-INFO. Or visit CDC's website at www.cdc.gov/flu.